To determine the correct brace size, measure the calf circumference 6 inches or 15 centimeters below the mid-patella with the leg in full extension. The configuration required is selected according to which side of the knee that is affected. Open lower and upper buckles. Ask the patient to sit down and extend their leg while fitting the device. Place the device on the patient's leg with the hinge on the affected side of the knee. For proper height positioning, align the bottom of the Össur logo on the hinge with the upper edge of the patella. Please note, for off-the-shelf braces, an additional yellow line has been added for improved visibility. For proper side positioning, the front edge of the hinge cap should be at midline of the leg when looking from the side. Place the blue lower buckle button into the blue calf shell keyhole, and use the palm of the hand to snap the lower buckle closed. Position calf strap above the widest part of the calf. Fold the strap at the appropriate length into alligator clip if needed, and fasten the strap so that it keeps the device securely and correctly positioned on the leg. Next, place the yellow upper buckle button into the yellow thigh shell keyhole and use the palm of the hand to snap the upper buckle closed. Adjust thigh strap to appropriate length by tensioning around the leg and folding into the alligator clip if needed. With the patient's leg extended and both smart dosing dials at the lowest setting, adjust the length of the dynamic force system or DFS straps until they sit firmly against the leg and then fold into the alligator clip. At this point, the patient should not experience any tension or unloading. Adjust the lower DFS strap in the same way. Ask the patient to bend their knee with the foot flat on the floor. Turn the upper and lower smart dosing dials clockwise until indicators are in the middle position. Have the patient stand up and verify the correct positioning of the brace. Insert fingers into popliteal pad openings to detach the hook and loop and slide the pad to an ideal position in the popliteal area. Once position is achieved, push down to reattach. Have the patient take a few steps to verify correct positioning of the device and tightness of the straps. Determine optimal DFS strap tension based on the patient's pain relief feedback. If the patient requires more or less tension, with indicator at middle position, adjust the length of the DFS straps accordingly. Aim for the final smart dosing dial setting to be at the middle position, since this will give the patient the ability to adjust the dosing during daily activities. When the final fit has been confirmed, remove the brace and trim the straps to the appropriate length.